So the first question is, what is CJD? So this is a neurodegenerative disease that presents with rapidly progressive dementia. It is caused by an infective protein called the prion protein. In terms of diagnosis of this condition, we take clinical criteria, we look at the CSF, and there are specific findings on EEG and MRI. That's what we are going to discuss today. I also strongly recommend that you can go to the CDC website that is shown here and look at the diagnostic criteria for a definite, probable, and possible CJD. Clinically, patients present with a rapidly progressive dementia. They have startled myoclonus, so if you make a loud sound, they seem to jump in the room. They have prominent cerebellar signs, so cerebellar ataxia, cerebellar issues with regards to walking. Some patients may present with pyramidal and extrapyramidal signs such as Parkinsonism, and in later stages, patients can have akinetic mutism, meaning they get stiff, rigid, and nonverbal. If you suspect a patient having CJD, CSF is mandatory. You check for a test called RT-QuIC, which stands for real-time quaking induced conversion. So this test specifically looks for the prion protein. Other tests that are suggestive of neurodegeneration are 1433 CSF assay and high tau protein in the CSF. Obviously, you need to make sure that this person does not have any other infection or inflammation that may account for these particular symptoms. So you want to rule out for HSV encephalitis. Make sure patient does not have any kind of a malignancy. EEG is not diagnostic of this condition but very supportive of this condition. So in EEG you may have non-specific findings such as diffuse slowing. You can see FIRDA, which stands for frontal intermittent rhythmic delta activity, or you may be lucky to find the characteristic periodic sharp wave complexes that are seen in patients with CJD. I will show you some examples of this EEG in later slides. MRI is also mandatory when you're making a diagnosis of CJD. You specifically look for high signal in caudate and putamen, and you can also find an increased signal in the thalamus and in a cortical ribbon involving frontal, temporal, or parietal head regions. Patients with CJD often are confused and disoriented. They are very fidgety and may be restless, and therefore when you record an EEG, the recording will be suboptimal. You will see a lot of muscle artifact as we see on this slide. The important thing and a key thing is making certain that you also look at the EEG using appropriate filters. So I normally use a low frequency filter of 3 Hz and high frequency filter of 15 Hz to get rid of this muscle and movement artifact. So when I apply that filter to this particular EEG, this is what I find, and you are able to identify the periodic discharges that are there. Another key thing is making certain that you compress the EEG and look over the EEG again. So now on this particular slide, I'm looking at 30 millimeters per second, and then I change it to 15 millimeters per second. If you do not use proper filters, you're going to miss the specific characteristic findings of CJD, which are the periodic sharp wave complexes. So now I apply those filters that I just mentioned, and we can see all the periodic discharges. So the periodicity is approximately once per second. If you're still not able to identify it, let me show you over here. So these are the periodic discharges that are characteristic of CJD. If you do see these findings on the EEG, it is supportive of the diagnosis in the right clinical context. If you do not see these findings, you still cannot rule out CJD because it's only found in approximately 60% of EEGs. One suggestion is make certain that you look at the EEG back and forth a few times, use appropriate filters, use appropriate montages, compress the EEG, and you are more likely to find these characteristic periodic discharges. This next page here is from the same patient taken at a later time. If you had recorded at this time, all you would see is just background slowing and some muscle artifact and no periodic discharges. When you report to the referring physician, you do mention that periodic discharges are supportive of CJD but not diagnostic. The test that is most specific is CSF for RT quick analysis. Thank you for your attention.